Hey guys, this is my group: Jordan Alexander, Jillian Bradford, Laura Bynum, Katie Manick, Sumner Richardson, and Ashley Shelton. And we created this poster, Managing Conflict Through a Nurse's Lens. So, kind of just to start with an introduction of really what conflict management is. It really just involves using skills from a leadership standpoint in order to like anticipate, prevent, resolve issues, especially in a workplace. Um, and really, through conflict management, you really want to be able to have open communication channels with your colleagues because this really fosters the best kind of working environment that you can have. So that way, your work environment can progress and everybody can really operate just at a high level. Um, and so the impact that this has on nursing practice. So conflict management is actually really important in the healthcare setting, just because whenever you have poor communication or poor leadership, um, it can really be detrimental to really the entire team and even past the team. And so really how we want to go about this. I mean, there's a lot of different strategies that you can use to handle conflict, but really what we're going to focus on are kind of the key takeaways per se for conflict management. And so the first thing you want to do is you want to identify what the problem is, okay? And then the second thing you want to do is you want to form an idea on um, ways that can potentially help bring the conflict down, help diffuse the situation, because each different conflict has its own different set of variables and needs to be handled differently. Um, and so number three is respond to the conflicts that could happen or are currently happening. You have to make sure that you address them directly. And then number four is implement that plan into the work environment and weigh the outcomes of the plan. You have to see how that does. Um, and then the last one is just to provide effective communication between coworkers, so that way we can minimize the errors when handling patients, because in a healthcare setting, that is the direct consequence of um, what we are doing, essentially. Um, and so, really, we just believe that it's very, very important that before these kind of situations arise, nurses need to make sure that they check their views and their own beliefs and their own preconceived notions, their own biases, um, to having cultural awareness and situational awareness, so that they can decrease the tension. Because if you don't really just check yourself at the door, you will probably have larger issues. You need to make sure that um, you look at yourself and you think about, okay, I was raised this way. I was led to believe this. You just really need to check those things before. And when you do that, um, people on the other side of the aisle of you really will have some respect for you whenever you're coming at them from a different angle than maybe they would approach it. And so, like we have here, it just builds rapport between the patient and the nurse, or even the nurse and the nurse, like both the nurses. Um, and so, it really just helps with effective communication overall. Um, and it's imperative in our setting, because this can really decrease you know medical errors and injuries and problems that doesn't just impact nurse on nurse interaction. It really impacts all of us, including the patients. And so on the other side, we see talk about skill building. Really what we want to do is we want to address the conflict and the conflict management behavior as the first step, so we can start creating a healthy work environment if we need to, if we're not in that space already. And then we want to make sure that we use our strategies to resolve the conflict early, so we can influence the work environment, so we can really optimize everything. And one thing you can do is you can use role playing in scenarios. You can kind of feel, um, if I was in their shoes, if I was in their shoes, how would it be if they were in my shoes? How would it be? So that way you can kind of almost step through the situation before you even really have to. Um, and then also be purposeful and thoughtful whenever you're engaging in conflicts, because I mean it's very difficult. People don't like to be told that they're wrong, so you really have to be thoughtful about all the things you're saying, and you really have to think through the things that you're doing. And all of these things are directly related to the patient's care if you don't handle this adequately. And so, in regards to our nurse leader that we got to talk to for our snapshot, we had Dr. Elizabeth Bridges, and she was wonderful. She was outstanding. Um, she's she's very decorated. She's served in the Air Force. She's done all the things. It seems like she's a very busy woman. But when we got to talk to her, she was really there for us, honestly, and it was so nice. Obviously we have some quotes here. The key is to not make everyone the same, but to support diversity in the opinions, which is not something that is necessarily always common. And then the other one is, at the end of the day, what do we want to accomplish? And so this. Obviously, we want better. We want to have better care. We want to provide better care. So, really, those are the things that we're trying to accomplish when we want to be better. And so, you have to support diversity. And so, really, she was just saying essentially that the key to good progress is to have both the people that want to foster change. You want to promote forward thinking and promote change, and you want people to be innovative. Don't just think in this box. Basically, you want people to take chances when it's right. Obviously, you don't take chances with patient care, but and put them at risk. But just kind of challenge the status quo and look to be different, really. She found that very, very important. Other people and the way they see things is very, very important to her. And she also believed that it was very, very, very important to set a goal and to work towards its accomplishment. And so all of these things are amazing. Really, she was so fantastic. She just really kept pushing us to listen to little guys and push other people up on a higher pedestal the best we can. And we won't find fault in that necessarily. And so again, she was absolutely fantastic. But you know, we feel that we were able to learn a lot from her. So that's us. That's our idea on managing conflict through a nurse's lens throughout the semester. And thank you so much.